During difficult femoropopleteal bypass operation, the surgeon inherently place clamp across the femoral nerve. It remains there for most of the procedure. At the end of the operation, the nerve is inspected, and it is in continuity but has evidence of being crushed. Which of the following is most likely occur over following weeks? So, what procedure? That means a femoral-popliteal bypass operation undergone, and a femoral nerve was clamped, and at the end, there was being crushed. So, what occurs in next few weeks? Here are the options. Options are Wallerian degeneration, rapid restoration of neuronal function because axon itself is intact, normal but delayed neuronal transmission due to disruption of the myelin, absence of neuroma formation, and none of the above. So what will occur? So first of all, here see some important nerve injury. There are three important types. One is the neuropraxia, second one axonoptosis, and third one is the neurotmesis. The neuropraxia, that means nerve intact. The neuropraxia is this position, nerve intact, but electrical conduction is affected due to covering of the nerve is affected. And in this condition, there is fully recovery and autonomic function fully preserved, and Wallerian degeneration usually not occur. So in case of the neuropraxia, there is no significant injury. Then later on, which is the axonotmesis, that means axon is damaged but the myelin sheath is preserved. That means covering of the nerve is completely preserved but axon, some part of the axon is damaged. The connective tissue framework is not affected, and in this condition Wallerian degeneration occurs. And last of all, which is the neurotmesis, which is the most severe injury, and in this condition disruption of the axon and myelin sheath. We know the nervous tissue it formed by the axon and its myelin sheath and surrounding connective tissue, and in this condition Wallerian degeneration occurs. Now see in the picture here, we can see the different type of the injury. First of all, the neuropraxia, that means he had only pressurized in the myelin sheath and it recovers very soon, and there is no Wallerian degeneration. And in case of the axonotmesis, we can see the part of the axon, the inner part is the axon and outer part it is the myelin sheath. So inner part axon, outer part myelin sheath. And in case of the axonotmesis, mainly the inner part, which is the axon, part of the axon is damaged, and in this condition as the outer part, that means the myelin sheath intact, so what occurs, this axon gradually increase its size and finally recovers. But in this condition Wallerian degeneration occurs. So here the Wallerian degeneration occurs. And in case of the neurotmesis, which is the most severe form, and in this condition the axon lost and also the covering myelin sheath lost, so complete loss. So in case of the complete loss, the axon usually cannot take any type of the guidance. In case of the axonotmesis, there is a guidance, that means the sheath increase within the myelin sheath, but in case of the neurotmesis there is no axon sheath. So what happens, usually the haphazard type of the growth occurs in this condition, and again here the Wallerian degeneration occurs. So it is the NAN, the mnemonics is NAN, that means neuropraxia, axonotmesis and neurotmesis. So in short about the Wallerian degeneration, it is the axonal degeneration distal to the site of the injury. That means here the site of the injury, and this part is destroyed by our own macrophage, and typically begins within the 24 to 36 hours of following the injury. Axons are excitable period to the degeneration occurring, and myelin sheath degenerates and it phagocytes by the tissue macrophage. That means the macrophage in our own body, they remove the distal part of the neuron, and it is known as the Wallerian degeneration. So what occurs in this condition? In this condition, Wallerian degeneration, because here we can see at the operation the continuity present but the evidence of being crushed. That means the axon is crushed. The axon is crushed, but it maintains its continuity. That means the outer covering present but axon is crushed. So in this condition, Wallerian degeneration occurs. Wallerian degeneration occurs in case of the axonotmosis and in case of the, here we can see, in case of the axonotmosis and in case of the neurotmosis. In these two conditions, Wallerian degeneration occurs. And Wallerian degeneration, it occurs at the distal part of the neuronal injury, and this neuron usually phagocytosis by the macrophage. Other option here, such as the rapid restoration of the neuronal function because of the axon itself is intact. Here the axon not intact, here axon damaged. Normal but delayed neuronal transmission due to disruption of the myelin. No, here is no myelin injury. Here actually the axon injury, myelin is completely intact. Absence of neuroma formation, it is also not true, because neuroma formation occurs in this two conditions. That means the axonotmosis and neurotmosis, there is a chance of the neuroma formation. What is neuroma formation? Suppose this is the outer covering, which is the axon, and neuron which lies inside. What happens actually when this neuron increase size, it can be impacted on side and it forms like a granuloma, and as it's from like this condition or ball like condition, it is known the neuroma formation. So it may also occur in case of the axonotmosis, in case of the neurotmosis.